Hi, I'm Dr. Jerad Gardner, and I'm an associate professor of pathology and dermatology at the University of Arkansas for Medical Sciences in Little Rock. And I'm here today with Dr. Hafeez Diwan, who's a professor of pathology and dermatology at Baylor College of Medicine in Houston, Texas. And Dr. Diwan was one of the people who helped train me when I was a resident interested in dermpath. So it's really an extra special treat for me to get to have this interview of him since he's one of the people who got me into dermpath to begin with. So welcome. Thank you for joining us today.
Well, thank you for having me. I'm honored and flattered. And hopefully you won't be disappointed.
I'm sure I won't. How did you decide to become a dermatopathologist?
Well, it's kind of interesting. When I was in medical school, I didn't care for histology or dermatology, which is basically the combination that I'm doing right now. And then when I came to this country, fresh off the boat, I did a PhD. And then I didn't want to do night call, very rigorous night calls, like you'd get in medicine or surgery. So I said, what could I do? And so I said, maybe pathology. So I went into pathology. And then while I was doing pathology, we had this really brilliant dermatopathologist who was in Mobile, Alabama. His name is Marcelo Horenstein. He is amazing. And so he really inspired me to become a dermatopathologist, because at that time I had the mistaken impression that dermpath was all basal cells and sebkase, and I said, I can do this. And so
that's, you got into it thinking this is going to be great, basals and sebs.
This is going to be like a smooth sailing and no problems. And so anyway, so that's what I did. So then that's how I got into dermpath.
At what point did you realize, oh boy, this is a lot more than basals and sebs?
That became apparent because when I was applying, I remember when I applied, I sent out maybe 25 applications. And I didn't get a single response, not one, not one. And it was purely accidental that, and I'd almost accepted a search path fellowship where I trained. And then it so happened that they were new groups, a new couple were taking over the dermpath fellowship at University of Alabama, Birmingham. Excellent. My mentors are amazing. Doctors Henry Skelton and Kathleen Smith. And but they were starting this new fellowship program, and I was in Alabama. They were in Alabama.
That's perfect, huh?
It worked out perfectly. And so I kind of accidentally was able to maneuver myself without actually getting a single interview in the normal way.
That is awesome. That's a great story. Now, how did you make it from there to Texas?
So that's also interesting, because many, many years ago, I have cousins in Texas, in Houston actually, and I'd come to Houston. I can't remember, maybe 20 years ago, and I said, maybe more, yeah, maybe 25 years ago, and I said, it's very unlikely that I'll ever settle in Houston, because I thought it was kind of flat. But now I like flat.
Yeah, it's pretty flat.
But flat. The thing about flat is that it's flat and there are no hills, and I'm scared of hills. I've discovered I'm scared.
You're scared of hills. Okay.
I'm scared of hills. So now I like the flat.
That's good to know.
So it just so then I was looking at after my dermpath fellowship, I was looking at all kinds of jobs, and naturally being like most humans, I'm a bit greedy, and so I felt like...
and that's why you're in academics, right?
Right.
Yes,
it works out perfectly, right? So I said, maybe I should, there were all kinds of job openings, as you know, in dermpath, there are lots of job openings, and even more so when I was a fellow. But I felt that maybe I need to get some more background, because the fellowship seems too small, like just a year.
It's enough to let you know, wow, there's a lot of stuff I don't know still, right?
You're terrifying. Right. You're absolutely right. So I said, maybe let me get my feet a little bit firmer on the ground. And so I decided, and I think it was the best decision I made, is to go to MD Anderson Cancer Center, where I had the fantastic ability to work with Dr. Prieto, Victor Prieto, who is an amazing friend and mentor to me, and so I started enjoying that lifestyle, and so that's how I kind of ended up.
And that's when I met you, when you were at MD Anderson, and then I think towards the end of my training you went to Baylor. Well, now the story is complete. That's awesome. I want you to tell me about the puffy shirt sign. You have a lot of very colorful and interesting ways of explaining dermpath, which is part of why I really loved working with you early on, because it was always really funny and also memorable. And to this day, Dr. Shaylin and I, in our practice, we still say, oh, this looks kind of puffy shirt. So the puffy shirt is alive and well with us, and I see you published it recently.
I just, with
Amanda Moyer, right?
Yes, Amanda. You know Amanda?
I do.
She's brilliant.
Yes.
So Amanda wrote this up, and so basically the way it started was Seinfeld, right? I don't know if you remember the Seinfeld episode where he gets this puffy. He's Kramer's girlfriend, I think. She gets him to wear. She's a low talker. She speaks very soft, so he can't say. And so somehow he agrees to get this wear this puffy shirt, but it's a horrible shirt. And I watched that show contemporaneously while I was signing out. And to me, it seemed that the puffy shirt, if you think about it, is a lot of shirt in very little
Too
space.
small, like it's all frills, right?
Yeah,
And,
so it's like they've taken an excessive amount of cloth, maybe the kind that you'd use for a curtain, and kind of put it all in a shirt.
We'll put a link to the puffy shirt in the comments below this video.
Please do so. So then I said, nevoid melanomas, which are so easy to miss.
Oh yeah.
I started thinking that just like the puffy shirt is too much shirt in too little space, a nevoid melanoma is too much cells. I know it's incorrect grammatically. But too much cells.
It's okay, it works.
Too much cells in too little space.
If it keeps you from misdiagnosing a nevoid melanoma, it doesn't matter how grammatically incorrect it is.
Well, yes, thank you. So that's what I said. So I started calling this a puffy shirt appearance. And to this day, some people say, I don't understand what you mean by the puffy shirt appearance.
I like how you said too much shirt for too little space, too much cells for too little space. That's a perfect way to explain.
Right. So, you couldn't use the too much cells in the paper because it's grammatically incorrect, of course.
But it's more fun for here.
It's more informal, I can say that. So that's where the puffy shirt appearance came about, and then I have tortured my fellows ever since, and anybody who would listen.
And anyone, and now everyone will know.
Well,
we're going to get the word out there.
Oh, great.
Do you have any other particular colorful things that could come to mind? I know that's.
Oh, yeah, actually, I'm going to present something tomorrow, which I don't know if I can use it. I'm going to present it, but do you want me? It's in the evening slide symposium. Should I tell you?
Oh yes, it's fine. No one will see this until long after the evening slides are done.
Okay, so it's called the Boris Johnson hair effect. Okay, so it's become one of my favorites. Okay, and the Boris Johnson hair effect, which and there's another name for this, which I'm going to just tell people. I just thought of it yesterday when I was walking, and you know how your pants get frayed.
Yes.
I think it's a ploy to get us to buy more pants.
They build the hems to make them fray easily.
Make them very, very weak hemmed pants.
Very evil.
I think it's all.
You're probably right.
Plan. Yeah. So the idea is that just like Johnson's hair is kind of frayed at the edge, these pants are fraying at the edge. So I have come upon these acrolentigenous melanomas. They get very, very very, very frayed at the end. Rather, they almost don't look like that.
Oh yeah,
you know
it's
what I'm
terrifying.
It's terrifying.
Just so few cells, right?
Yes, exactly. So I have called it the Boris Johnson hair effect, which I'm going to debut tomorrow.
I love it. I love it.
And another one which I like is the pregnant seahorse appearance.
Okay, I haven't heard that one.
So the pregnant seahorse appearance I think it's like nature's revenge. They're not necessarily women seahorses.
Right, the males keep them right in the pouch or something, yeah?
It's the guy. It's the guy who's giving birth to those thousands of... so basically, molluscum contagiosum. Not a very difficult diagnosis to make, right? But if you don't cut into it...
Oh, yeah.
You see, the cells look very stuffed, just like a pregnant seahorse.
Oh, that's brilliant.
So I was... this was... So I said, I like this pregnant seahorse. So I tried to get one of my fellows to publish it, and she was embarrassed. She said, I don't think I want to publish this. And so, but I respect, because, at the beginning of your career, you need to be more respectful, I suppose. And this is
agree to disagree. I don't think so.
No, I think this is a little more risque, more informal,
But I think it's a good point, because I love that, actually, because no one ever looks at the cell size of molluscum, because once you see molluscum bodies, who cares? cares?
Yeah.
But I've seen a case like that that was originally, they called it atypical squamous, worrisome for squamous cell, but it was a 10-year-old girl.
Yes.
And it didn't make sense. And the pathologist who saw it said, it doesn't make sense, but it looks like squam. And I saw it and I thought, gosh, it does look atypical. But something about it reminded me of molluscum, and I couldn't quite remember why. And only since I've realized the cells get really big.
They get really
so
fat,
we cut deepers and got the outside block, molluscum bodies showed up. And so this young girl could have had a pretty large surgery she didn't need. So the pregnant seahorse sign could have, been useful. And there may be patients out there like that are going to be saved by the pregnant seahorse. So we got to get it out there. Maybe your next fellow will realize it's legit. And
Well, yeah, in fact, one of the residents has collected a bunch of cases. So she's written the app, she's kind of written it, and I'm kind of editing it right now.
Now, one of my life and career goals is going to be to write a paper about a humorous sign with you before I retire.
Please do
This is on my to-do list now. So if you can't find the next one you come up with, let me know. And
I will. Yes.
I want a Gardner and Diwan, legendary sign. That'll be fun.
That'll be fun, yeah.
That's awesome. What do you do in your free time outside of medicine?
Well,
the little bit of it that there may be.
It's surprising. It's not as little as you would think, and I don't know why. I mean, because when I go home, I turn the work Diwan off.
That's good. It's hard to do.
Yeah.
It's taken me many years, and I still struggle. But it's really important. But it's hard
because and then I do meditate.
Cool.
And
does it help? Do you like it?
I love it.
I'll have to try to learn how.
It's very simple. I mean, it's not complicated. I mean,
if it's complicated, then it's not meditation, right? I guess.
Exactly right. So I do meditate. I read a lot. Not much fiction, more nonfiction. I like to write. So I just. I'm not going to get political.
Okay. What's something non-political you've read recently that you liked?
What was it? It was, in fact, I'm reading it right now. It's called Good Habits, Bad Habits by Wendy Wood. I think her name is Wendy Wood. And I read like multiple books at the same time. There's a book about the spy and the traitor, about this guy KGB guy who didn't defect, but who spied for the U.S. I'm enjoying that book.
Cool.
I'm assuming somebody from Russia would enjoy it less, probably. but it's and what else am I reading? There's another book about this American female, and she spied for the U.S. during World War II, and she was instrumental.
Wow!
So I like
the spy stuff is cool, huh?
I like the spy stuff.
Have you read any Malcolm Gladwell? I feel like you would like Blink, and all of his books are so wonderful to me.
I have flipped through some of those. I just bought his book.
Talking to Strangers, the new one. I haven't read it yet.
Yeah, so it's on my list of books. And
Malcolm, if you're out there, I'm like one of your biggest fans. It's amazing, and I love his podcast, Revisionist History. Really? Oh, it's beautifully done. Oh, really? I feel like he talks about a lot of stuff relevant to pathology and medicine. I don't think he maybe realizes that it's relevant to us, but I feel like there's a lot of stuff there. Yeah. Blink, especially, it's about like looking at things and being like, something's wrong, and kind of how your subconscious mind recognizes problems and kind of alerts you to it, even if you're not cognitively aware.
Exactly.
And I think that's kind of useful for us to know. I feel like I should be worried about this case, but I don't know why.
Yeah.
And so that's kind of an interesting thing. You should check it out. It's good stuff.
Yeah.
That was the other thing I wanted to ask you about. You shared in the past, gave a really nice talk at ASDP a few years ago, and one of the things you talked about was about the differences in diagnosing things before lunch and after lunch, and about how hunger impacts our diagnostic ability. It was both fascinating and terrifying. Tell me a little more about that.
So the preamble to that is that we are dermatopathologists.
Yes,
but we're also human beings.
That's true,
right? And so we have to appreciate that, subjectively speaking, we have many things which can impair our ability. One of them is food. So there was this study I came across. There was a study. It's a very famous Israeli parole board study. So Israel, country. They have prisoners. Of course, every country has prisoners. And so some of the prisoners are Arabs, Arab Muslims, and then they are the Jewish prisoners, right? So they go before the parole board, right? And so they found that regardless of whether you were Arab or Jewish, if you went before the parole board and it was before lunch, or if it was when the judges were hungry, then the parole was likely to be denied.
Wow.
The prisoners wised up to this, and so they had these little systems whereby they would make sure that they ended up after lunch or after the afternoon tea time, so that they could have the nicely fed judge, who could then vote.
Hopefully, be a little bit more gracious. Yeah.
Vote in their favor.
Have mercy, huh?
Right. And
wow.
And so yeah. So
kind of terrifying.
Kind of terrifying. And then I was thinking. I was speaking to on that same thing with the session you mentioned. The speaker was Dr. Jane Grant-Kells, I think.
Oh, okay.
Remember she was there?
Yeah, that's right.
So she mentioned that we tend to get more malignant as the day wears on because we are getting tired.
Yeah.
It is easier to call something malignant because then you don't have to worry about it.
Right. Exactly.
So and it's just the way with to give you an example. So there have been studies to show, if people are people are asked to exercise their willpower, like say, they'll keep these nice pastries or cakes or whatever, and they say that, no, you can't have them right now, wait a little bit, 15 minutes later you can have them, or 20 minutes, whatever. And then they do some other task, right? They found that later on in the day, the people who had been asked to abstain from the pastries, as opposed to another group that was not asked to restrain their impulses, the people who had spent their willpower trying to abstain from the pastries were less able to ward off temptations later on during the day.
They used it all up,
So willpower is a
finite resource,
thing,
huh?
yes. So,
wow.
So in fact, I wrote a book about it called Instant Willpower, and it's self-published. It's a secret. Nobody knows about it.
Now they do.
So it seems.
I'm gonna have to buy it and then tweet about it. And
please do.
Take the secrecy away.
Yes. So please do. I would welcome that. So the trick to having lots of willpower is not to have to use it. So for example, this afternoon, so this afternoon I was sitting with at lunch, the business lunch.
Mm-hmm.
So I was sitting next to Dr. Slominski.
Uh-huh.
And we had this delicious cheesecake.
I saw it. And it's there the whole time, right?
It was there the whole time, but I ate it, of course. And I was telling, and Dr. Slominski said he didn't like to eat the sweets too, but it was sitting right there. So I said the only way to avoid the sweet is to not have it in front of you. Because if it is not there, then no need for willpower. You see, so anyway, and that is what happens, as we make these, and we're making these decisions, early on in the day or whenever the slides come out, and we have to exercise our control.
Mm-hmm.
Maybe you want to call something severely dysplastic just to get the case out of your thing, not worry about it, or you want to, you don't want to think, could this just be a seborrheic keratosis instead of a squamous cell carcinoma? Mm-hmm. And, all this is depleting us.
Yeah, that's a good point.
Right? Now, in some people, they're seeing hundreds of cases, I mean, if I were a patient, I wouldn't want to be the 100th patient. I'd want to be the second patient.
Well, it's like you said, we have to accept that it's challenging, and I don't think we like it, but that we can't have like 100% identical objectivity and performance at every single interaction we make. And I mean, like you said, there's tons of science to support that. So we have to think through about what things are high risk scenarios, right? And avoid those when we're maybe at a lower point. So when do you deal with your hard cases? What time of day do you find best to deal with hard cases?
So so basically, everybody's different.
Sure.
In my case, if I want to look at a hard case, if I sense that a case is hard, so what I do is I try to build up the confidence, which means that I will look at the easy cases, mm-hmm. like 10 of them or whatever, SEBK, basal cell, sponge derm, you feel like Superman. You can do a power pose, whatever, just tell yourself, I've been doing this for what? 20 years, I can't remember how long I've been doing this, but surely I should be able to do it by now, even if I don't. I should be able to do it by now. And so I say to myself, just put on your big boy or big girl pants and do it. Okay? And so that's how I kind of psych myself. And and if I can't find the inspiration, I just leave the case. I go in search of some delicacy. Like a nibble of a cookie or an almond or something, or just go and chat with someone, just take a little walk. short walks.
Sure, yeah.
Yeah, because obviously you want to get the cases done. So to treat yourself as a subject and to recognize the fact that anybody who's married can recognize the fact that we are full of flaws.
Yes.
We have imperfections, okay, which are visible, which are there. So if you think of yourself as I think what I'm trying to say is that we shouldn't have too much hubris. Be very humble and mean it. I mean, in the sense, because the clues session today, I don't know if you attended it.
No, I was busy working, but I missed it.
It was a fantastic session.
I saw some tweets from
it. So they had the most excellent collection of clues, and so many things. Like, for example, the clue from Sarah Shalin about the thrombi and scabies, or Tammy Ferringer's clue about the CD34 in morphia, or the iododerma, the one that looked like cryptococcus.
Oh, the histiocytoid sweets. It's cryptococcus. I've seen that. It does look like it. It's crazy.
And then the nice collagen trapping in lymphoma. I mean, there were a whole bunch. I wrote them all down.
I was going to say, I'd love to see. I wish I could see a recording of that whole thing. That'd be amazing.
So I wrote down all the clues, and so because I thought that this is amazing. It was a fantastic session. So I think we should remember that we are mere mortals, and I know that if I want a different diagnosis for myself, I just have to wait till the morning, and I'll have it.
That's what I find when I have really hard cases. I'll kind of look and I'm like, I still am not sure what I'm going to do with this yet. And then I usually wait until the next morning, and then come in early, kind of before anyone's there. And I feel like that's when my mind is freshest. And I was always a late night person, not an early morning person, but I really forced myself over the past 5 years. I get up really early now, and I find that once I got used to doing it, I get the most, like, if I need to write or really do something creative or that takes a lot of intense thought, that's the time where I'm going to do it. And then if I really can't sleep, I'm just like, I'll send it out and get it, because sometimes that's how I learn. It's like quality control for me, but it's both also scary and reassuring to hear you say, I should know how to do this. I've been doing this 20 years, because I can't think that too. I'm like, when's this going to get easier? I keep thinking one of these days I should know all the answers. And you're right. Hubris can't last for long, because you'll get some new case that just beats you back down to baseline, right?
Absolutely. Yes.
It's difficult. Well, this is really amazing, and I think these are incredible practical tips, and I like that you make them in a way that's colorful and fun and accessible, because whatever it takes to get you to remember, right, that helps you get the right diagnosis for the patient. It doesn't matter what it takes. That's what it's all about, right?
I agree.
So thank you for all that you've contributed to my knowledge personally, and now that you're contributing to everyone else's knowledge out there.
Well, my pleasure. Thank you so much.
It's a pleasure having you.
Same here. Thank you.